Annabelle joins me now along with Dr Hilary. So how are you feeling?
Much better 2 weeks on.
Yeah, a bit of swelling though. There was a bit of swelling.
Yes.
It's still...
I bruise very easily though.
Right, OK. Well, let's have a look. You know, if you look there and we can do a comparison and let's see. Do you know what? It looks to me like you've been on a really good holiday.
If only.
Do you know what I mean? It looks like you know, we were talking about this before, Hilary, weren't we? You look refreshed.
Yes.
Do you feel better in yourself?
I feel better, actually.
Because that's what it's all about. You've got to do it for yourself, haven't you?
Definitely. Been through a miserable divorce, and this is coming out the other side.
Yeah, and it's just to get your confidence back,
Yes.
really. So, talk us through what was done.
Well, she had a Nefertiti lift to improve the jawline definition. Nefertiti was the Egyptian queen who had a wonderful neck. And what we do is use muscle relaxants into the platysma muscle, which is the flat muscle at the front of the neck. And that tends, when that's active, it tends to pull down the lower part of the face, causing some sagging. So by using muscle relaxants there, we relax the whole of the neckline, and I think you felt that's a big improvement.
Yeah, you feel better with that one.
She also had thread lifts done.
Right.
So here you insert threads into the skin, underneath the skin, from above down into the lower face, and you pull up the skin. Yeah,
like
it smooths out a little bit, So you're smoothing out the lines on the outside of the skin, but also you're helping to lift any sagging skin, because everything tends to drift a little bit south as the years go by.
Indeed.
So she had that done, and some other muscle relaxant treatment around the eyes, didn't she? I think.
Yes, up here, and yes, the neck.
So altogether a softer appearance.
And your hands as well.
Yes.
Oh, okay.
We've always had old hands.
Well, they always say that's first sign.
And of course, the other thing you had was the vampire facial.
I did. Yes.
Now, with the vampire facial, you take blood from the patient, so there's no risk of allergy because you're using your own tissues, and you centrifuge the blood so that you separate the components of the blood, and you end up with plasma which is enriched with platelets.
Okay.
These are the.
So you're putting yourself back into yourself.
Yes, and the platelets are the little fragments which help to healing and blood to clot in blood vessels where there's been an injury. And by injecting that into the face, you stimulate collagen and new cell regeneration.
So, what was it like getting that done? How did it feel?
It's definitely uncomfortable, but I had anaesthetic.
Right.
Local.
So not
very
unbearable?
Unusual experience, I'd say, because I've never had anything done before.
And when you looked at yourself and you, right afterwards, you said you were very, very swollen. Yeah, was that a bit scary? You just sort of
it was a bit of a shock.
Face.
But, I mean, that's normal.
Right.
And actually, it went down quite quickly. You just need rest. I think that's the one thing. You do need a few days off.
Just to chill.
Yeah.
Yeah, exactly.
Which obviously I didn't do. Went straight back to work, which was a mistake.
Right, OK. But right now, when you look in the mirror, do you see somebody that you recognise? Have you got you back, if you know what I mean?
I'm nearly there.
Right.
And there's a little bit more swelling to go, but as I said, I bruise really easily. But it's not an unbearable process, and the doctors were amazing.
Yeah, of course.
Really nice team there.
Absolutely. So, Hilary, it's all about managing expectations, isn't it? When you go into something like this, you're not suddenly going to look like you did as a teenager. So I think sometimes you've got to be aware, haven't you? And you've also got to be aware of any risks.
Of course you have, and that's why the consultation is so important. The consultation with the same surgeon who's going to do the procedure, and you were in very good hands. Now, it's important to ask questions. So you would have been told that there would be some downtime afterwards. There might be a little bit of bruising, a little bit of swelling. Fine to go back to work usually within 2 days, but probably a week before you go to a party. You know, and obviously you've got to be careful with any facial treatments you have afterwards. None for 2 weeks. So you don't want any beauty treatments, any dental treatments afterwards. You want to avoid things which help to thin the blood, because that can enhance the risk of bruising. So no aspirin, no ibuprofen, paracetamol if anything. Arnica's quite good. No vitamin E, because again the bruising problem. And I think advice like this is really important to take on board before you go along with the procedure. And yes, it is going to be a little bit uncomfortable. You're going to have some local anaesthetic cream to minimise that. But go in knowing as much as you can about the procedure with realistic expectations.
Exactly, that's what it's all about. And it's not for everyone.
It's not for
everybody. The thing what we're saying here today is, you know, with the results of the survey, there are a lot of women who are not, and men, who are not happy with how they look. And this is just one option, but it's absolutely down to you. And you feel
yes, and it's
better.
because it's no knives.
Yeah.
You know, I think it's fine.
And of course,
it's lovely.
It's not permanent.
No.
We're talking about maybe a duration of 2 years.
OK,
So
then you
it's
may
not
have to
bad.
go through it all again.
And well, it's certainly a lot less traumatic and a lot cheaper than having a surgical facelift.
Sure.
Yeah.
So there are benefits.
I'm glad you're happy. That's the main thing. That's what it's all about. It's make you feel better about yourself. And that's what, as I say, that's what it's all about. Thank you, Annabelle.
Thank you
It's a
so
great
much,
result.
Lorraine.
Thanks, Hilary. Thank you very much.